Now, First News presents a 27 Investigates special.
The heroin and opioid crisis is getting worse. New numbers this week show a 30% jump in emergency rooms treating people who've overdosed. It's even worse here in the Midwest.
Well, it's either the hospital or jail. Pick one.
Here in the Valley, the epidemic is killing a person almost every day. More than 330 people died last year from overdoses. Billions of dollars already spent to fight the problem. But is it working?
I've been to 27 different drug rehabs.
Tonight, 27 First News introduces you to a man who's fought addiction for almost 30 years.
I've done heroin, cocaine, crack, pills, uppers, downers. I've been getting high for a long time.
Through his struggles, he finally found treatment that's helping.
I just got this one on February 12th. I made 5 years.
This is 27 Investigates, the heroin crisis.
For the past 18 months, 27 First News has been working to find solutions to the crisis. Here's what we have on tap for you tonight. We'll look at the approach to law enforcement and how that's changed, what's working and what's not with treatment, and what needs to happen to get people the help that they need. Now, we will present some good info and some great stories for you to share tonight and listen to you, but this is also to help you. The phone bank is open for you right now. It's right behind me, 1-866-782-4581. Our trained phone counselors are standing by, ready to answer your questions. Keep in mind, your question is important. These trained counselors can provide answers, and they are ready to connect with you. The phones are already ringing right now. All right, the phone bank, just one part of our effort here tonight. First News anchor Stan Boney's in the studio. He has 4 special guests who will be part of our panel discussion on the heroin and opioid epidemic. Stan?
Well, thanks, Dave. One thing that is certainly a part of all of our 27 Investigates heroin crisis specials is the panel of people that we bring in. And tonight we have a diverse group that is with us that will be able to talk about everything involved in the heroin crisis, overdoses, and the law enforcement, and even the political end of the heroin crisis throughout the state of Ohio. Let me introduce you to the 4 people that have joined me here on the panel this evening. To my right is Michael Tobin. He represents the U.S. Attorney's Office for Northern Ohio. Next to him is State Senator Sean O'Brien. He represents most of Trumbull County in the Columbus State House. Off to my left is Tomas Santiago, and he is a recovering addict. Is that the right way to put it? And we are going to hear a lot of his story as the night goes on as well. Next to Tomas is Cheryl Hirsch. She's the Clinical Director of Family Recovery Center. They have offices in Lisbon and East Liverpool and also Steubenville. Covers much of Columbiana County. But we are going to start tonight with Tomas's story. A lot of times when we're talking about the heroin crisis, you think maybe it is middle-class people, rich kids with a lot of money. But Tomas's story is pretty much what the other end of it is. It could be something out of a newspaper, the crime clippings. We're talking gangs and drugs and robberies and drugs and even more drugs. First News anchor Mandy Knoll tells us what it took to get 5 years sober.
Tomas Santiago grew up in the Bronx, New York City. At 14, his stepfather left his mother.
My family knew how bad I was. They knew the stuff that I did since I was young.
His mother and siblings could stay with the rest of the family, but Tomas, they said, could not.
At the age of 14 years old, I became homeless. I stole a car, lived in a car for about a year. Then I started living in pigeon coops.
Abandoned buildings and city streets became home.
I started doing all the tattoos, getting arrested. I was a full-blown heroin addict here. I also was in one of the largest Latin gangs in New York City.
Santiago says the notorious Latin Kings gang became his new family. These pictures are the only ones left of that life.
I ran each of these 4 corners right next to the methadone program. And these guys here were family members, plus they also were my bodyguards.
A teenager making thousands of dollars a day dealing drugs. And when he ran out of drugs or money, he would rob people.
I've been shot 4 times, stabbed 7 times. And it was all due to either bad transaction me trying to rob somebody and didn't know they had a gun, or trying to rob somebody and didn't know they were going to fight me back by stabbing me.
When he really ran out of drugs and money, he would check himself into rehab. He would meet people, network with other addicts. It was his system. He'd get back on the streets and start over using those contacts. For decades, his cycle continued. Today, he's 48. In his early 40s, he moved to Youngstown to get away from that life. But it followed him. He continued using.
Then I met my wife in Youngstown, and that was the kickoff to my life that I have now. She had faith in me.
He's been to drug rehab dozens of times. Finally, one worked.
The first thing that came out of Laura's mouth is, "You can do it." She said, "I can see it in your face. You can do it."
In Salem, Mandy Knoll for 27 Investigates.
And joining us again is Tomas Santiago, along with the other members of our panel. How did you get rid of it? How did you recover?
It all started with, of course, giving my life to God. The second was meeting my wife, who I finally had somebody that believed in me. I was always told, you're going to go to prison, you know, or you're going to get killed. So once I met my wife, I had committed a felony. It was misuse of a credit card. And I was on methadone, so I didn't want to be on it because I was on methadone for over 22 years. So I went to Florida, came back, turned myself in, and something you know, out the ordinary happened. I had a judge right here in Youngstown, Judge Sweeney. I told her my story, I told her the changes I made, and I asked her for an opportunity, even though my parole officer wanted me to go to prison for 5 years. My lawyer wanted me to go to prison for 45 days and ask for early release. And the judge looked at me and she said, "I'm going to give you a chance." And I said to myself when I walked out of there, her two secretaries said, "I've never seen anything like that ever happen in this courtroom." And when I walked out of there, I said, okay, I got 3 people on my back. I got God, I got my wife, and I got Judge Sweeney. I'm not going to let none of these people down at all. I let people down my whole life. This time I'm going to start. I got 3 on me now. Now I got to look for some more. And that's when I found Family Recovery and met Laura, Cheryl, and then met the director, Eloise. So now I got 6 people.
Right.
You know, so after that, I said, this is all I need. I'm completely surrounded, and I'm going to make it. And as of today, I got 5 years and 2 months.
Cheryl, what was the plan? I mean, be specific if you can. He just kind of took us through the story. But once you heard what he had gone through, I suppose you had to sit him down and go, okay, pal, this is what we're going to do.
Exactly.
What was the plan?
Well, accountability is one thing, getting him through IOP. But the first question is, do you want this? Are you serious?
Right.
You know, and just looking in his eyes and saying, I want to do this. And we told him it's going to be hard work. You know, you're going to go to intensive outpatient program. We're going to put you through, you know, years of counseling if that's what it takes. We have recovery coaches, we have counselors, and we're available to them, you know, 24 hours a day, 7 days a week. Call.
So mostly it's counseling?
Yes.
Yeah.
You didn't want to do any type of methadone, did you?
No.
You didn't want to inject anything in your body to take care of it.
Well, I was tired of being tired, and I figured out a puzzle. I said the reason I was doing heroin from the get-go was because I had anxiety and I had a panic disorder. So once I figured that out, and I started going to mental health doctors and combined with Family Recovery, and they guided me through to continue to see my doctors, and then I found out I had PTSD from the things that I went through in New York City, and then I actually worked for a company in New York which was called E-Commerce Group, and I was actually there on 9/11 across the street. So I had all these things going on. I was suicidal, and so with my mental health care and Family Recovery, it all came into a package.
All right, let me bring Sean and Michael into this discussion. One thing he mentioned was that it was a judge, the legal system, Michael,
Sure.
that's kind of started it a little bit. I mean, he had to have it in his own brain that he wanted to do it. Right. So the legal system helps as much as it can arrest and police, right?
It does, and it's interesting you bring that up because I've seen a change over the last few years where we've talked to police officers who, when this crisis started, just wanted to arrest everybody and knock them up. And now they're saying, you know, is there a way we can get them into treatment? they're not looking to lock them up. They want to get them help. But at the same time, I've heard from people who've gotten sober who've said, you know, I didn't see it at the time, but the best thing that ever happened to me was going to jail, because at least I wasn't going to overdose. It was forced detox. So every situation is different, and I think the legal system is trying to adjust to be more flexible than it has been in the past.
Sean, you see anything in Columbus as far as the legislature handling something like this?
Oh, yeah, absolutely. But I want to go back on a point that he made, that when I was a prosecutor, and it's interesting that you brought this up, is that I had a case where a woman was constantly stealing from her family. They couldn't get her on a drug charge, and we actually had to prosecute her on a misuse of a credit card, which was a felony 5, to try to get her into the drug court, because at that time there were no misdemeanor drug courts. In Columbus, recognizing what's going on, we have started those, and those are becoming more prolific throughout Ohio. I believe in Trumbull County we have 2 or 3 right now, and they're very helpful.
Cheryl, are you a fan of drug courts?
Absolutely. We have one in municipal drug court in Lisbon, at the municipal court there, and it really makes a big difference. They're accountable. They go in weekly. They look at the judge. The judge can see their accountability, their willingness to make the changes. Absolutely. We're not going to arrest our way out of this, and I've heard people say that, but I think there are still people who want to truly believe that. And so the purpose of having Tomas and different people share their stories, you're absolutely right. Sometimes 30 days, 45 days, gets their attention. It gets them clean and sober then. But the problem is we don't have enough places long-term, 28 days. You know, monies have been cut. It's just they're less and less all the time. You know, 7 days is not enough for someone who is an opiate addict that needs to be in treatment. And so we need those, and then we can move into outpatient. But absolutely, I truly believe, I've been to Judge Durkin's felony drug court. Yes, excellent. And so in Columbiana County, we're just starting in this year to work those things out and getting the common pleas prosecutors to reduce it so that they can come into that municipal drug court.
All right, we have shared a success story with you here so far this evening, but we have more of 27 Investigates, the heroin crisis, coming our way. As we mentioned in the open of our show, the CDC recently released some numbers showing that the number of overdoses within the last 18 months is up. We are going to head to St. Elizabeth Hospital, go into the emergency room there to see what kind of problems they have been having with overdoses. And once again, we want to remind you, we do have counselors in the building. You can certainly pick up the telephone, give us a call. There's the number on your screen, 1-866-782-4581. You can see they are on the phone. If you get a busy signal, please call back. If you have questions about heroin, opioids, fentanyl, carfentanil, give them a call at the number on your screen. 27 Investigates, the heroin crisis. We'll be right back.
"27 Investigates, Heroin Crisis." Sponsored by Travco Behavioral Health.
With a mission of helping residents with mental health and drug or alcohol illnesses, we are here for you and your family. For more information, find us online or call to set an appointment.
Substance use disorder is a chronic brain disease that has potential for recurrence and recovery. We can help. The Surgeon General reports 1 in 7 people will develop a substance use disorder. We can help. First Step Recovery is a medically licensed subacute detox and treatment center. Our mission is to provide a path for wellness and recovery and improve the overall life of individuals struggling with substance abuse. Contact us today and get the help you deserve. We recover when we have the courage to take the first step. First Step Recovery.
I think that I'm here for a reason because of the things I've been through in my lifetime. I should have been dead a long time ago. What causes me to want to get high? Once you figure that out, if it's sadness, happiness, you have to solve that issue. Family Recovery is there to help people like us. This addiction is taking everybody, even now more and more teenagers, because there's more and more drugs on the street. Family Recovery is the place to go.
Making the decision to seek recovery can be difficult. Getting the help you need shouldn't be. You'll find services are easy to access at FSR Parkman in Warren. We are now open with plenty of room for new patients in our brand new facility. You won't have to wait to start your road to the long-term sobriety you deserve. We'll create an individualized treatment plan to suit your unique needs. Don't wait. Call us today for a brief screening. Reach for recovery at FSR Parkman.
Welcome to the Auto Show. How's it going?
Hey, how are you?
Let's check out some Chevys. What's your first impression here?
This car is really amazing. Well, this is nice. Wi-Fi.
That's really impressive.
That's awesome.
And what if I told you that you can get Auto Show cash right now?
Cashback is always great. Oh my gosh.
Use your Auto Show bonus cash to get an additional $1,000 cash allowance on this 2018 Chevy Silverado. See your local Chevy dealer today.
You're watching a First News special. 27 investigates the heroin crisis.
Well, the number of patients filling emergency rooms and the number of overdose people is rising at a truly alarming rate. In fact, just this past week, the Centers for Disease Control issued new numbers showing overdoses up at an alarming rate between July of 2016 and September of 2017. Now, nationally, the number of overdoses treated in emergency rooms jumped 70% in the Midwest. That's just alone. You can see it's up 28% in Ohio and 81% in the state of Pennsylvania. But what do all these numbers mean? Well, recently, in fact, just this morning, we went to the St. Elizabeth Emergency Room in downtown Youngstown, and we wanted to see how the overdose situation was affecting them there. Here's First News anchor Dave Sess.
Dr. Matthew Eggleston is Assistant Director of Emergency Medicine for St. E's. He says the downtown emergency room saw the same increase in overdoses as the rest of the Midwest, about 75%.
We're often seeing a mixed picture. So we're seeing cocaine overdoses that are being mixed with fentanyl. We still see plenty of pill overdoses, but we're even seeing marijuana overdoses that are being laced with fentanyl.
Narcan, or naloxone, is the overdose reversal drug carried by ambulance crews and many police officers. This video is from an officer's body camera in Niles as first responders revive an overdose patient. But even with Narcan, that patient needs to go to the emergency room.
The increase in overdoses, it's putting significant pressure on all of our emergency departments. Typically, when we have an overdose that comes in, that patient requires several hours of monitoring to see if they need subsequent doses of Narcan administration or if they even need admission to the hospital.
Mercy Health has peer recovery coaches available in the ER for overdose victims. Together with the doctors, they try to guide addicts to ask for and get help.
Providing them with some withdrawal medications and some of the resources that are available to them both within our hospital with like an intensive outpatient therapy program or other community resources.
In Youngstown, Dave Sess reporting for 27 Investigates.
You know, we talk about the heroin epidemic, the opioid crisis very often. Cheryl, let me start with you on this one. Is it getting better? Is it getting worse? Or is it staying the same?
Certainly not getting any better.
Not getting better.
Not getting any better. The heroin is a little different. Now we're running into the fentanyl, the carfentanil, and they're putting it in cocaine, in marijuana, and so that's the problem, or pure fentanyl. And there's a new drug out now that the Narcan doesn't even touch. It doesn't revive them at all. And so heroin, maybe it's not getting any worse, but it's the new drugs that are added on that the people are dying from.
Is there any medical purpose for fentanyl and carfentanil? I mean, I understand the opioids, I understand morphine, and it can be used medically to decrease extreme pain. But fentanyl and carfentanil, is there a medical use for it?
Well, the fentanyl is for pain. The carfentanil is an elephant tranquilizer, from what I'm understanding. Yes.
So it's on the market for that, but now people are using it at the same time.
Correct.
And Michael, we talked just earlier about the fentanyl and the carfentanil, and can't we arrest people that are dealing it?
We can and we do, but you know, Cheryl referenced the cliche, we can't arrest our way out of the problem. It's a cliche because it's true. We could arrest everybody, but that's not going to fix the problem. It's part of the problem, but at the same time you need fewer pills being prescribed, you need treatment for people who've who've already been sucked into addiction, and we need to think differently about pain, whether that's educating our kids or educating people in the hospital. We work with the FBI, DEA, and Postal to cut the flow of fentanyl and carfentanil as best we can, but at the same time that it's coming over from China, we're inundated with boxes of people ordering stuff on Amazon Prime. So we do the best we can, but it's a problem.
You talked earlier as well that the chain of command has changed. It used to be you arrested somebody on a street corner who then led you to the middleman, who then led you to the kingpin.
Sure.
It's not that way anymore, is it?
No, I mean, you know, like Sean was talking about his days in the prosecutor, if you've seen Serpico or The Wire or anything like that, you understand the kingpin and how it works down. That's pretty much gone out the window. We've got people who are ordering drugs directly from China over the internet or the dark net, and what we say is it's amateur hour on the dealer side and it's amateur hour on the user side. Nobody knows what they're selling and nobody knows what they're putting in their arm, and because of that, that's contributing to the fatalities, I think.
Sean, you represent Trumbull County, and Trumbull County has really been covered by the news media in this area, and probably rightfully so. They have more overdose deaths, they have more overdoses, they have problems up there. Have you been brought into that issue?
Yes, and you know, we're number 7th in the state, in the counties, and what's interesting, when you look at the state, you know, Northeast Ohio, we stick out. Most of the 1 through 10 are in the lower southern part of the state. And when I first got elected, the problem was the prescription drugs, and that's where we started this. And we've had to modify how we look at it as lawmakers to enact new laws to deal with the carfentanil and the fentanyl, because of that's now what's come in. We've actually seen a reduction in prescription drug overdoses, but we still see a spike in overdoses overall for opiates because of whether they're using heroin or now cocaine is back, and they're spiking it with this dangerous drug. So what we need to do is look at treating drug addictions there. It's always going to be there. Drug trends are going to change, but the addiction is not, so we have to focus on that.
Joe, do fentanyl?
Yeah.
You did?
Yeah. It's a dangerous drug because it doesn't, you don't know the impact on it. You can just do a little bit. It changes from dealer to dealer. So you can do a little bit from one guy, and then you're going to need more. And then you can go to somebody else 2 or 3 days later and do that same little bit, and you're out. You're just laid out on the floor. So it's a really dangerous drug because it gets put into the heroin. So in New York, people don't, you know, addicts, I'm a recovering addict, so us addicts, when we're getting high, we don't think rationally. So there was a heroin in New York City in the Bronx called Tango and Cash. It was killing people left and right. Well, the idea was, where is that drug at? It's got to be really, really good because it's killing people. So that's what they chase.
It's not that it's killing people, it must be really good.
Be really good, not that it's killing people. So now with them putting the fentanyl inside the heroin, they're saying, wow, that must be some real good heroin.
I think the one thing you said that was interesting there is drug addicts don't think rational.
No, we don't.
As we're sitting in here, we're trying to have a rational discussion about this. But if we brought a drug addict in here at the moment, the conversation would change totally, wouldn't it?
It would change totally, because an addict, when you wake up and you don't have it, you're sick. You can't concentrate. You know, your mind is going. Your first thing you're thinking about is, where am I going to get the money? What am I going to sell? Who am I going to call? So you got all these things going on in your mind, and you can't concentrate. So even though after you get high, now you're so relaxed, you still can't concentrate. And you know, addicts don't want to hear the truth. They always make up excuses for themselves why they're getting high. I'm getting high because my wife is, you know, a pain. I'm getting high because my kids are driving me crazy. We always use excuses why we want to get high, instead of saying, you know what, I got a problem, I need to solve this.
Steve, can I make a statement?
Yeah, go ahead, Cheryl, go ahead.
One of the other things that we have found, that addiction is just not a problem with drug use. There's an underlying issue. Sometimes depression, bipolar, ADHD, you know, we find that they gravitate towards specific drugs when they have that specific. And so to say, yeah, we're going to help them with the addiction, but if we don't help them with that underlying problem of the mental illness, they're just going to go back out and use because they probably do have a chemical imbalance. The brain chemistry is not balanced out. So they need something, proper medication that's going to lift that.
Yeah, can I say something? That's true because I've always had, back in the 70s, my mother took me to a doctor. And back then, if your kid had anxiety, panic attacks, whatever, it was called ADHD. My mother knew I didn't have ADHD. I had anxiety and panic attacks. As I got older, I used heroin. It was my magic drug. It took away the anxiety and panic attacks. And then I ended with PTSD and all that other stuff. So a lot of addicts have a mental disorder. So if the programs go ahead and make it like a mandatory, you want the medication, we're going to help you, but you need to get this mental evaluation to see if that's also an issue we can work, because it worked for me. I got my mental disability taken care of. As far as the medication I'm on, non-narcotics. I'm on 6 different medications and they're all non-narcotics. And we also got to talk to these doctors because a lot of them want to hit you with Xanax and all this other stuff. If it wasn't because of family recovery holding me accountable and saying, you're going to take Suboxone, you can't be on that anything addictive or narcotic, I would have not been taking 6 different medications that are non-narcotic. So it was a combination of the program and mental health care that got me to where I'm at today.
Yeah, we are going to take a break here. There are a number of places that addicts can go. Family recovery is one of them. Some of them are faith-based. But coming up, we're going to introduce you to a man who found his sobriety through a program in Cleveland. First News anchor Dave Sess will introduce us to Jesse Greathouse and tell us what milestone Greathouse will reach tomorrow. So I want to remind you, we do have counselors here in the building. If you have questions concerning anything that we have talked about, the heroin crisis, fentanyl, carfentanil, if you know somebody that is addicted, you can call one of our counselors we have here in the building. The number 866-782-4581. 27 investigates the heroin crisis. We'll be right back.
"27 Investigates Heroin Crisis," sponsored by Family Recovery Center.
Making the decision to seek recovery can be difficult. Getting the help you need shouldn't be. You'll find services are easy to access at FSR Parkman in Warren. We are now open with plenty of room for new patients in our brand new facility. You won't have to wait to start your road to the long-term sobriety you deserve. We'll create an individualized treatment plan to suit your unique needs. Don't wait. Call us today for a brief screening. Reach for recovery at FSR Parkman.
Are you striving to reach your full potential? Are daily stressors overwhelming to you? We can help. Are you struggling with addiction and looking for medical-assisted treatment? We can help. Travco Behavioral Health, an affiliate of First Step Recovery, offers outpatient psychiatric and therapeutic services for mental health and addiction needs, treating adults, adolescents, and children. Get the help you deserve. Contact us today for a location near you. We recover when we have the courage to take the first step. Travco Behavioral Health.
With a mission of helping residents with mental health and drug or alcohol illnesses, we are here for you and your family. For more information, find us online or call to set an appointment.
First Step Recovery is introducing Outpatient Detox at our new Boardman location, the first of its kind in the Valley, offering physician-supervised care in a structured outpatient setting, incorporating individualized treatment with daily monitoring by physicians, clinicians, and nurses, giving effective care during the day while remaining in their home at night. Get the help you deserve and take the first step to sobriety. Contact us today at 330-286-0054.
After the procedure, it was a godsend. Night and day. I would definitely recommend Vera's Vein Institute.
Call today. Our vein therapy is covered by most insurance. My legs feel great again. I can do all the things I couldn't do before.
I'm only limited by time, not by my legs.
Take the first steps to healthy veins. Visit VerisVein.com.
All the soreness is gone.
The ultrasound and the consultation's free. The results are amazing.
I'm back to life again.
VerisVein, Howland and Hermitage.
First News Special 27 investigates the heroin crisis.
Well, trained counselors have been answering the phone since 5 o'clock here at WKBN, 866-782-4581. It's your chance to call in and get a question answered. Josh Dankovich from Family Recovery joins me now. And you and I have been talking, and I asked what is kind of a first step here. And you told me it's always an assessment. Why is an assessment important?
Well, the assessment drives treatment, so any new client coming into Family Recovery is going to come in, get assessed, check out the risk factors, and then go from there.
And one thing I've always heard while out in the public is people always ask about Suboxone or Vivitrol. Are those drugs important, and what is their role?
Those drugs are important, taken correctly, obviously. They are to help with the recovery process. And the main thing that I guess is a big misconception is that treatment is the most important piece, not the medicine.
Yeah, so they're more of a medicine to help along the way, but the treatment really helps with the overall picture.
Absolutely, yes.
All right, Josh, thanks very much. Thanks for your work on the phone bank tonight. Appreciate it. Now, one thing we found out is there are success stories to be found during this heroin crisis, and it's very important that they be shared. Now, I found one and wanted to share with you the story of Jesse Greathouse, his comeback, and how he achieved it.
I have a whole new attitude and outlook on life. You know, life means something today.
Jesse Greathouse is celebrating 1 year being sober tomorrow. He told me he was living an insane life between 2008 and 16. Served a year in prison for possession of heroin, booked into the county jail over 10 times, and been to numerous treatment facilities from here to Florida.
Well, even through the midst of that active addiction, I wanted to be sober. I just couldn't stop.
Jesse's addiction started after a car accident. He was prescribed Vicodin before the doctor cut him off. He found OxyContin, then a buddy offered heroin. His family told him they loved him, but they couldn't take it anymore. Jesse calls that his bridge to hope. He checked into the Leah House in Cleveland, a long-term treatment facility.
There's no profit motive here. Their motive is just to help another drunk, help another addict, to get their life together. And I think that's the difference between this and the treatment centers that we're used to.
Jesse calls addiction a disease of isolation and disconnection, that the stigma has people hiding it from family, neighbors, even their employers. I asked him what he learned, which gave him insight into the way addiction is looked at or treated.
I'm glad you asked that. Let's lock up, or addicts are looked at as bad people. It's not looked at as a health problem. I think if we can look at them as sick people, not bad people, then we can start some change.
Jesse's life has changed. He works in the kitchen at a detox and substance abuse facility while going back to school. He's completely flipped to being a positive person and believing people who tell him things are getting better, including his family.
Thank God they don't have to put up with my bullcrap anymore. And thank God that they don't have to come home and worry if anything's going to be stolen or worried if they're going to get a phone call that I'm dead.
Jesse Greathouse also told me that love, compassion, and hope are very important to share with addicts. He believes making that change and also looking at addiction as a health issue would lead to an easier path for addicts to get treatment. Maybe you're wondering how to start. That's why the phone bank is here tonight, 866-782-4581. Trained counselors are here on the phone, ready to talk with you, and they'll help tell you how to make that first step and what you can do to start getting your treatment. Now, coming up, our panel will discuss long-term care and how to get people in treatment when they're ready. That's ahead here on WKBN 27. And earlier, we introduced you to Tomas Santiago. He's been sober for 5 years after being in and out of jail and fighting addiction for 30 years. He tells us what he thinks is working and what needs to change to help get people off of opioids. This is 27 Investigates the Heroin Crisis.
"27 Investigates Heroin Crisis," sponsored by Compass Family and Community Services.
First Step Recovery is introducing Outpatient Detox at our new Boardman location, the first of its kind in the Valley, offering physician-supervised care in a structured outpatient setting, incorporating individualized treatment with daily monitoring by physicians, clinicians, and nurses, giving effective care during the day while remaining in their home at night. Get the help you deserve and take the first step to sobriety. Contact us today at 330-286-0054.
I think that I'm here for a reason because of the things I've been through in my lifetime. I should have been dead a long time ago. What causes me to want to get high? Once you figure that out, if it's sadness, happiness, you have to solve that issue. Family Recovery is there to help people like us. This addiction is taking everybody, even now more and more teenagers, because there's more and more drugs on the street. Family Recovery is the place to go.
Making the decision to seek recovery can be difficult. Getting the help you need shouldn't be. You'll find services are easy to access at FSR Parkman in Warren. We are now open with plenty of room for new patients in our brand new facility. You won't have to wait to start your road to the long-term sobriety you deserve. We'll create an individualized treatment plan to suit your unique needs. Don't wait. Call us today for a brief screening. Reach for recovery at FSR Parkman.
Substance use disorder is a chronic brain disease that has potential for recurrence and recovery. We can help. The Surgeon General reports 1 in 7 people will develop a substance use disorder. We can help. First Step Recovery is a medically licensed subacute detox and treatment center. Our mission is to provide a path for wellness and recovery and improve the overall life of individuals struggling with substance abuse. Contact us today and get the help you deserve. We recover when we have the courage to take the first step. First Step Recovery.
Welcome to the auto show. How's it going?
Hey, how are you?
Let's check out some Chevys. What's your first impression here?
This car is really amazing. Well, this is nice. Wi-Fi.
That's really impressive.
That's awesome.
And what if I told you that you can get auto show cash right now?
Cash back is always great. Oh my gosh.
Use your auto show bonus cash to get an additional $1,000 cash allowance on this 2018 Chevy Silverado. See your local Chevy dealer today.
You're watching a First News special.
Take just a little bit here to talk about the long-term recovery aspects of the heroin crisis. And when you need to talk about long-term, you always have to talk money. Somebody has to fund this whole process, and most of it comes from the government, and that's where State Senator Sean O'Brien comes in. The Medicaid expansion that the state of Ohio implemented, it's been several years now. You were behind that and a part of that and supportive of that, weren't you?
When you saw the need that was out there, and you got to remember the ancillary problems that happen with this addiction, with this crisis. The children's services, the local government strain on that first responders. So we had to try and get people to get help as quickly as we can. And by having money now to get into the Medicaid, to go to these facilities like yours, was very helpful. And again, we did see a reduction in prescriptions overdoses, but the long term is where we still struggle now, because you know, in Columbus we've seen cuts to local government funding for programs like this. So the Medicaid expansion was critical to help in this area.
Cheryl, where do you get your money from? Who funds you?
Well, we're private non-profit. A lot of our clients have the medical card, so we can, you know, get the medical. We have some funding from our board, from the county.
So you use Medicaid. So that is a government program.
Correct.
And do you get private donations? Do you seek them? Do you?
Certainly, yes. We have some people with private insurance. We take donations from the general public. We go for grants, you know, whenever.
Is money an issue?
Yes, it's always an issue. One of the ways it's an issue is, right now we have limited of 16 beds in a detox, and there's a waiting list. And so when we have somebody who calls and says, I'm ready, or mom calls and says, they're ready, they want to go. Right. And now we have a waiting list because we can't get them in, or it's 3 or 4 days. Heroin
one of the
users,
big discussions I know in the debates is beds.
Yes.
We need beds, and that's that where the waiting list comes in?
Yes. We can get them in. We have same day they can get in and have an assessment, but if they're detoxing, counseling isn't going, that's not what they need day one. They need to get to a bed, detox, and then to long term, at least 30 days. Some people a little bit longer, but we just don't have the beds, and I think the funding has even been cut for some of those facilities, so it's not good.
That's a federal law with the 16 beds.
Okay.
And that's something we're looking at. Now, Pennsylvania has a waiver that they've used, and we're looking at that in Ohio to get around, you know, the 16-bed limit. Because, again, like you said, when someone's ready to detox, they need to go in now. They can't wait.
Well, you have heard a little bit of Tomas Santiago's story, and we're going to continue here briefly with a little bit of that story as well. What he says made the difference needs to happen to match the force of heroin addiction. He came from a life of violence, gangs, and drugs. And once again, here's First News anchor Mandy Knoll.
The expression on people's faces when I robbed them, taking away something that they work hard for, that has haunted me for a long time also.
Living sober, Tomas Santiago has clear memories of his old life in New York City. From his teens to early 40s, a life in the Latin Kings gang, robberies, drug deals. He's been shot and stabbed, but it's in the past. 5 years ago, at 43 years old, he found the Family Recovery Center in Lisbon.
And the reason Family Recovery worked for me was because I was held accountable.
Drug tests, counseling, meetings, speakers.
I've never failed a drug test. I've never got a strike. I've never been suspended. 2 years, then 3 years, and then 4 years, and then I just got this one on February 12th. I made 5 years.
Today he's married. He's a Salem homeowner. He does want to clear one thing up, though. The heroin crisis isn't new.
Back in the 70s and the 80s, it was just in the ghetto. It was in low-income families.
The problem is blowing up because of where it's spread to and how quickly a heroin addiction takes over a person.
It's wildfire. That's what I see it. Wildfire. And the only reason there is a little bit of acknowledgement is because it hit the suburban areas.
Middle-class families affected by this ugly epidemic could be the catalyst to change.
They want rehabilitation, they want reform, they want more money for medication, want new programs.
Some treatment centers, he says, often treat addicts like cattle in a stable. Addicts are pushed through detox programs where they're a name and number.
Crime rate is going to get worse. I guarantee you, if we don't do something within the 5 years, this epidemic is going to be so bad that we'll never be able to get a hand on it.
And he says police need help.
They do a great, great job. They put their life on the line for us, and I respect them to the fullest. But they're just not enough of them. We need to invest more into law enforcement.
In Salem, Mandy Knoll for 27 Investigates.
I thought it was interesting that you grew up in the Bronx, you ran with gangs, you dealt with all this, but it was little old Lisbon, Ohio, in the middle of Columbiana County where you found your savior. I thought that was kind of interesting.
Yeah, when I came here, I came to Youngstown, and when I was on that highway, I said, man, I'm going to paradise. I got to Youngstown, and I said, oh, my God, this is little New York. Then I went to Lisbon. I said, oh, my God, this is little Youngstown. What's little New York? I said, this is not what I need. I said, okay, now I can't go nowhere no more. I got to make the best of this. I said, let me see what I can get. And I started going to the methadone program and, continue going. Things weren't working until I hit Little Lisbon. That Family Recovery held me responsible, and they said, you got to be accountable. This is what we want. If we don't do it, it ain't going to work.
Michael, one thing he mentioned is that he'd like to see police get more money. Is there enough funding with the feds and your office to handle something like this?
Well, I mean, we could
always use more.
I mean, we could do this 24/7. We could do nothing but this. In addition, and then there's all the other crimes. This epidemic is straining not just police, but all aspects of society. I've heard it said by my boss that this is a once-in-a-generation crisis. The morgues aren't built to handle the number of bodies. The crime labs aren't built to test the amount of drugs we're bringing to them. Police officers and firefighters weren't built to run from run to run to run, reviving people with Narcan. We've just never dealt with anything like this in 50 years.
What does the federal government and the federal prosecutor's office, how do you deal with drugs? I mean, what is your responsibility? You understand what I'm saying?
Yeah, I mean,
because you have the Attorney General,
Sure.
you've got local police departments.
Sure.
When do you come into play?
So we're focused on the large-scale drug trafficking. We're the wiretaps, the interstate and international groups. That's our focus. But of course, we have to work with local police, county prosecutors. There's all sorts of times where we'll get a case, somebody will die, you'll check his phone, take that intel, put it into a computer, try and make connections, and then talk to the county prosecutors. Well, does it make sense to take this as a state case, as a manslaughter case if somebody died, or does it make sense to take it federally and try and get 20 or 30 years like we've done here in Youngstown? But our focus is trying to make the big cases of people crossing state and national boundaries.
Sean, when you were a prosecutor, how did you guys deal with it at that point?
Someone would overdose, we would try and treat it as a crime, get in there, get the evidence. It has changed since when I was a prosecutor, because as we were discussing before, you had your kingpin, you had these ones dealing with it, and now it has changed so much that we have to prosecute it on a different scale. One thing at the state level, we've looked at carfentanil and fentanyl and changing their a degree of what that felony means so we can increase the penalties. We've been focusing more on the drug dealers than the drug users, trying to weed them out.
It's been a while since you've been a prosecutor. Not that long. 6 years, maybe?
6 years.
6 years. Did you see this coming when you were working in the prosecutor's office, or did you just wake up one day and go, oh my God, what happened?
And again, when I was a prosecutor, it was cocaine, some heroin, some prescription pills. The prescription pill was on the rise when I was there. Now, being a state legislator and seeing what's going on, and we've had our own committees go out into the community and listen to the people, our constituents, hearing what's going on. We're seeing so much more of it being, just like he said, it's coming from China, small bags, and catching these people is very difficult. So we've trying to increase the penalties for people using these type of drugs.
Cheryl, how long have you been doing this?
20 years.
20 years. Did you see it coming?
I don't think to this degree we didn't, but I think dealing with it every day and people like Tomas coming in from out of the area and realizing that what we've done in the past doesn't work. We have to do a different thing. So we are all about IOP groups. We drug screen 2-3 times a week, holding them accountable. That accountability partner we have, recovery coaches.
Did you start with alcoholism, or
Yes.
did you?
Yes.
And then you graduated to drugs and kept on going from there?
When I come in, I think alcohol, quite a bit of marijuana, and a little bit of cocaine, in the 90s. And then it just, when OxyContin came around.
That was a big change. That was a big change.
Within 5 years of that hitting the market, it just exploded.
And what I think is very important is these new drugs are so powerful.
Yes.
I mean, they change your brain path. I mean, it is the chemical makeup. That's how strong it is, and it makes you desire it so much more. So we're talking heroin in the early 2000s. It's nowhere near what it is now because it's mixed with these substances.
Have we got a grip on the prescription drug end of it? Are doctors no longer overscribing it like they used to? Are there still pill mills around?
We've enacted laws against pill mills. The governor enacted an executive order reducing the amount of pills someone's allowed to get. So we have seen, and I think that is what led us to a decline in prescription pills. However,
that helps.
It helps, but it's being taken over by now cocaine's back. Heroin's always there. Meth is back. Marijuana having fentanyl or carfentanil in it. So, again, the drugs are always going to be there. The trends are going to be there. We've just got to get to that addiction and find a way to combat that.
Just a reminder, we do have counselors also on location here. You can pick up the phone and talk to one of the counselors. Maybe you know someone who is addicted and they can help you out, guide you in the right direction. The number 1-866-782-4581. They'll be around until 8 o'clock this evening. We're back to wrap things up. 27 investigates the heroin crisis. We'll be right back.
27 Investigates Heroin Crisis, sponsored by FSR of Parkman.
Are you striving to reach your full potential? Are daily stressors overwhelming to you? We can help. Are you struggling with addiction and looking for medical-assisted treatment? We can help. Travco Behavioral Health, an affiliate of First Step Recovery, offers outpatient psychiatric and therapeutic services for mental health and addiction needs, treating adults, adolescents, and children. Get the help you deserve. Contact us today for a location near you. We recover when we have the courage to take the first step. Travco Behavioral Health. First Step Recovery is introducing Outpatient Detox at our new Boardman location, the first of its kind in the Valley, offering physician-supervised care in a structured outpatient setting, incorporating individualized treatment with daily monitoring by physicians, clinicians, and nurses, giving effective care during the day while remaining in their home at night. Get the help you deserve and take the first step to sobriety. Contact us today at 330-286-0054.
With the mission of helping residents with mental health and drug or alcohol illnesses, we are here for you and your family. For more information, find us online or call to set an appointment.
I think that I'm here for a reason. Because of the things I've been through in my lifetime, I should have been dead a long time ago. What causes me to want to get high? Once you figure that out, if it's sadness, happiness, you have to solve that issue. Family recovery is there to help people like us. This addiction is taking everybody, even now more and more teenagers, because there's more and more drugs on the street. Family recovery is the place to go.
Making the decision to seek recovery can be difficult. Getting the help you need shouldn't be. You'll find services are easy to access at FSR Parkman in Warren. We are now open with plenty of room for new patients in our brand new facility. You won't have to wait to start your road to the long-term sobriety you deserve. We'll create an individualized treatment plan to suit your unique needs. Don't wait. Call us today for a brief screening. Reach for recovery at FSR Parkman.
You're watching a First News special. 27 Investigates the Heroin Crisis.
The trained phone counselors have done an outstanding job taking your calls and answering your questions tonight. And one of them was here for the very first time, Mary Harvey from Family Recovery. What type of call stuck out to you tonight?
I was very surprised at the number of people who just called in to say thank you for having something like this, that it gave them a chance to call in with their appreciation, either with a story of a loved one who was able to get through addiction, or just the fact that they're a community member and they want to see this epidemic solved.
Showing you that they want some answers or solutions or something to this problem.
Do, and letting us who are working in this field know that they appreciate what we're doing.
And what does that make you feel inside that you were able to help tonight?
It makes me feel really good. Yeah, I'm very glad I came to this, and I would do it again. But it's been extremely eye-opening.
We appreciate your service tonight. Thanks for being here, and we'll see you the next time.
Okay, thank you.
She's Mary Harvey with Family Recovery. 866-782-4581. You got a few more minutes to get one of your phone calls in. Let's go back to Stan Boney.
Well, we are going to take the last few minutes that we have on this show to talk about what is next. What happens tomorrow? Where do we go from here? We pretty much laid out the problem, but now we need a few solutions. Mike, I'm going to start with you.
Solution.
I know I threw a tough one at you. I did. I apologize for that.
You know, law enforcement will do what it has always done, but the problem has to be much bigger than law enforcement. And I think if there's one thing I would hope that the viewers take away from this is just a little bit of empathy. We can talk about numbers and stats and per capita deaths and overdose deaths, but those are somebody's children or neighbors. That's somebody who's not at the Thanksgiving table. And we're all paying for this. We're paying for it in our court systems, in treatment, in our foster care system. So if if there's one thing I could say, it would be that we all need to come together and work collaboratively towards a solution.
Sean?
And I just echo what Mike said. This is a community problem. It needs a community solution. And we have to look at addiction. What are the roots of addiction? Unemployment rates, poverty rates, education. All those come together as part of it. We need programs long-term like what Cheryl's running. Those are some of what we need to do. But addiction's the underlining problem that we have to work on. And getting to those root problems, it's not easy. It's going to take a lot of work, but that's where we need to be.
Tomas, you had a magic wand. How do you fix this?
Yeah, my magic wand would be we got to stop putting people in jail that we hate and start putting people in jail that are a danger, and start helping the people that we do arrest, help them with the medical medicine they need from right off the back, so that way when they do get out, they got a foot in the door and not let somebody out who's still detoxing, because now they hate the system, they hate judges, and now you just created a monster.
Cheryl?
One of the things I would really like for people to just call an agency. We're in the phone book, Family Recovery Center in Lisbon, but there's so many agencies, caring counselors, people who truly do want to help. You know, we do a Project Dawn, which is the Narcan program down in Lisbon. And quoting one of our recovery coaches, Tanya, she said, "I can't help anyone if they're dead." Right. You know, and so if it's my mom or brother or sister, I want them to have the Narcan. I want to help people. And so, you know, we've got to start with the family. There are services for the family. If we can draw the family in, at least get them setting some good boundaries, but we do need the long-term treatment.
Michael brought up a good point, though, earlier. We got to reduce the demand, don't we? We can't do anything. If there's demand, the supply will follow.
Sure, and I think that goes to a little bit what you heard today. These organizations that are pumping the drugs in here are sophisticated, multinational, multi-billion-dollar organizations. They react to demand. When I started in the U.S. Attorney's Office 8 years ago, the cartels were pushing cocaine. And then demand shifted, and we can talk about whether that was because of the overprescription of pills and what role that played. But, yeah, we need to get to a point where people aren't looking to take a pill to ease their pain, whether it's their physical pain, their underlying emotional pain, whatever it is.
Are all the laws, we're regulated okay on this one at this point, aren't we? Well, you know what I'm saying? I think that the laws are in place to take care of the issues.
Yes, but sometimes they need tweaking or working. You know, he brought up a good point, Tomas, that is, you know, we got to look at mental health also. That is a major problem that people don't recognize as part of this crisis.
It is. Yeah. All right. I want to thank you very much for all joining us here this evening. It was an interesting discussion. Most of these are that we have had. It seems like every time I sit down with a panel like this, I learn something that I didn't already know. And Tomas, you certainly brought a different light and a perspective from somebody who has been on the inside and is now on the outside trying to get better. So I'm going to thank you all for joining us here this evening. I want to remind everyone that we do have a list of resources on our website at WKBN.com. And you have probably heard throughout the evening there are a lot of resources in our area, a lot of places that you can go to find places if you need help. Also, the phone bank, the counselors we have, they're going to be wrapping up here shortly. But if you are in need of help, you can dial 211. I'm Stan Boney of WKBN 27 First News. Thanks for watching. This is 27 Investigates the Heroin Crisis.
27 Investigates Heroin Crisis. Sponsored by First Step Recovery Detox and Treatment Center.
Are you striving to reach your full potential? Are daily stressors overwhelming to you? We can help. Are you struggling with addiction and looking for medical-assisted treatment? We can help. Travco Behavioral Health, an affiliate of First Step Recovery, offers outpatient psychiatric and therapeutic services for mental health and addiction needs, treating adults, adolescents, and children. Get the help you deserve. Contact us today for a location near you. We recover when we have the courage to take the first step. Travco Behavioral Health.
With a mission of helping residents with mental health and drug or alcohol illnesses, we are here for you and your family. For more information, find us online or call to set an appointment.
I think that I'm here for a reason because of the things I've been through in my lifetime. I should have been dead a long time ago. What causes me to want to get high? Once you figure that out, if it's sadness, happiness, you have to solve that issue. Family recovery is there to help people like us. This addiction is taking everybody, even now more and more teenagers, because there's more and more drugs on the street. Family recovery is the place to go.
Need a lawyer? Learn more at ElizabethBernardLaw.com.